The first thing that you should know is that children seem to be less likely than adults to contract COVID in the first place. Children, if they do get COVID, are much less likely to be ill. They're much less likely to be hospitalized, and we have not had any deaths from COVID in Ontario. In fact, it's about 1.2% of children in Ontario so far that required admission to hospital. And so that should make us feel better about, even if they do get COVID, that they still may be asymptomatic and they may be healthy and do well. Teaching them to wash their hands before they eat and after they're playing. Wear a mask when they're in public or in places where they can't be socially distant if they're developmentally able to, and get a flu vaccine for the fall. I think it would be a good idea to get advice from that person's physician in terms of the degree of risk for that person and what they would recommend in terms of the young children that are living in the house that are attending school. We will have to encourage children to change some of their behavior, wash their hands more often, that they may have to be more socially distant from the people that are living in their house. Find another family or a couple of families and start a social bubble of people that will be sort of committed to each other, and so you minimize the number of interactions that the children have, but do allow them to play with their peers in a way that is, good for their development. Keeping the lines of communication open with your child, not dismissing their fears. You can also make a playlist of songs that they can choose beforehand, and then when they are feeling sad or anxious, that they can hit play. They could have an area in their room with a beanbag chair and something soft for them to snuggle. If you do find that your child is sick with symptoms of COVID-19, whether it's fever or cough or vomiting and diarrhea, please don't be afraid to go ahead and get them tested. And if your child does get sick, please don't be afraid to bring them to hospital, because we will take good care of them and make sure that they're going to be okay.